Palliative care, the way I view it, really is alleviating suffering, whether it be emotional, whether it be physical, whether it be spiritual. It's really getting to know someone and where they're at a stage of maybe a dramatic change in their health, whether it be an advanced illness, and really meeting them where they're at and finding where are the points in their life that they're suffering and how I can alleviate that. And I would say hospice is specialized palliative care at the end of life, really focused on that particular portion of someone's life. Everyone needs palliative care. I think everyone in some point of their life has some sort of suffering and where you need that support. And I would say with Phelps, just in general, with all the advancements that we're doing in terms of the technology and more patients that are coming in, you have human beings coming into our hospital. And any human being coming in that may be suffering, we're there to be able to provide that, meet them where they're at. And so palliative care really is looking at the whole person. And it's something that Phelps, that is what we do. I feel like I'm really doing what I was made to do. It was my purpose in life. And you don't get that in other places. And Phelps values that. Team Lavender came about just as an opportunity to be able to support our staff. Working in a hospital is difficult. Working in a hospital, you have to continue to provide the care 100% each and every time, regardless of what's happening. You can go into one room and it could be someone who's dying. You can go into another room and it's somebody who may have an infection with IV antibiotics who's looking to go home very soon. And being able to be present in all those moments. Taking the time to really show that love and support is something that I feel is really unique to what Team Lavender can provide. Just a really special thank you to the core palliative care team. There's so many people who have just been so special to me and helping our palliative care team at the bedside, holding patients' hands, praying with them, in the ICU, on the floor. So I just want to thank all of you, because I consider all of you to be part of our palliative care team here at Phelps.
When you think of what's emblematic of the care at Phelps Hospital, you think of Dr. Michelle Espinoza and her team. Palliative care is so important. And when you deal with the families that Michelle and her team deal with, it's important that we recognize that what Phelps is about is caring, of helping people in need at difficult times. And Dr. Michelle Espinoza epitomizes that care and that giving of herself for other people.
I do think that one of the best things we've ever done here at Phelps was to hire Dr. Michelle Espinoza. Every day that we were here with patients with COVID, Michelle Espinoza was in their rooms, sitting with them, holding their hands, praying with them, crying with them, comforting them. As we all know, their families couldn't be with them, so she would bring iPads into the room so the families and the patients could spend a few minutes talking, being with one another, just sitting there. And that was what she did every day, all day long. When you walk around the hospital and you ask our team members or patients about Dr. Espinoza, you hear words like kind, caring, passionate, fierce, brave, and the one word you hear most often is angel.